the scene. So thank you so much for that. Um, this is the final session of the final day. So let's go ahead with it. So it's a very important topic, social media. And I think now the majority of physicians, especially in the GCC, are trying to get a social media platform, especially in private practice, because of a lot of myths, a lot of wrong things said on social media that we have a duty to correct. It also attracts a lot of patients to visit your clinic once they trust you on social media. So again, there are multiple objectives for the presence of a physician on social media. Today, we're going to quickly touch upon the landscape, so how social media has reshaped health communication, opportunities that we have in terms of patient engagement, education, and professional development, risks and ethics, which are very, very important because we need to be aware of this once we start showing up on social media, and a small practical guidance. So nowadays, if we talk 10 years prior or prior to 2010, we would not have such a lecture. So what happened in the past 10 to 15 years has really transformed the information landscape. Nowadays, social media is where patients first turn, before, during, and after their clinical encounters. I think in the clinic, all of us are used to patients coming and telling us, I saw this on TikTok, I saw this on Instagram, ChatGPT has told me so and so. So people come pre-prepared for your consultation. Uh, and even after you give them medication, after you give them advice, they recheck it through social media. And they might have, you prescribe a statin, you might find a patient having videos show up on social media, for example, spreading myths about statins and why the patient should not take them. So again, we do have a big role in educating the patients about the correct information. The scale is absolutely staggering. We have around 5 billion global social media users. So we're talking about 50% of the worldwide population. 80%, so 8 in 10 patients, will search online before or after a clinical appointment. And this includes information, general information about their disease, their symptoms, what they're facing. And they even search information about you, the physician they're going to visit. What are your qualifications? Do you have a social media presence? They try to get to know you before they actually visit you. 72%, so around three quarters of physicians and FCPs do have social media presence. So they use platforms for professional purposes. Actually, this data did, it was a bit, eye-opening for me, because I don't feel that 72% of us are on social media. I feel it's a much less of a percentage. But this data, these statistics are mainly from the GCC, where I think we probably might use social media a lot more than other countries. So we have an opportunity to use social media for good. So we have a lot of, as we said, a lot of myths, a lot of misconceptions that are being spread. Unfortunately, probably medicine is one of the few things that nowadays anyone is talking about. So any between brackets, between quotations, an influencer will come and talk about GLP-1s being horrible for you, for example, statins causing dementia, causing a lot of bad effects. All these things are said by non-medical professionals. And this is very important. Anyone has given themselves the license to talk about medicine. Meanwhile, me as a physician, I will not go talk about civil engineering on my social media platform, but an engineer can talk about medicine. So again, this is very important, and it gives us more and more responsibility to talk about and use our social media to increase awareness amongst the patients. Clinicians are trusted voices. And when we are absent from social media platforms, misinformation fills the void. And more and more authentic medical voices, they matter more than ever. Again, we have such a big role to fill up in this. So beyond the consultation, for example, if I would talk about my personal experience, I have quite, a big social media platform. So beyond the consultation, I usually give my patients my social media platform so they can check out videos that can help them educate them about their disease. For example, one of the common things we face is IBS, irritable bowel syndrome. So maybe you cannot say everything. You don't have time to educate your patient fully in your consultation because of time constraints. But when you have videos on your social media platform that your patient can watch later on, it might really help out a lot during the consultation and even afterwards. Social media extends the reach of clinical advice into the patient's daily lives. So it reinforces discharge and aftercare instructions. It supports chronic disease self-management. It reaches underserved and hard to engage population. These people in rural areas that sometimes do not have access to healthcare. It can help out a lot. But at the same time, you need to be cautious not to give any medication advice on social media where things can go wrong. So we always have to reinforce at the end of any video we post that please ask or consult your doctor before doing so and so. Last of all, it delivers preventive health messaging at a population scale. So we do a lot of activities in terms of awareness, for example, HPV cancer awareness, vaccination awareness, diabetes awareness. We can deliver all this through social media because it is delivered much easier to the patient than before. A long time ago, I think when we grew up, TV was the main source of info. Nowadays, people, I think I'm one of the people that does not watch a lot of TV anymore. We go on social media, we watch Netflix, we watch Prime, Amazon. So we watch a lot of things, including, platforms and not TV anymore. So again, this shows you that we use our internet much more than TV nowadays. So what are the public health campaigns that actually worked on social media? Vaccines work. It was a WHO-led campaign that reached billions, countering anti-vaccine narratives during the COVID-19 pandemic, where we had, I think that was the start of misinformation spreading, very quickly. Then we have cancer awareness. So breast cancer screening uptake linked to targeted social media campaigns in the UK. If I were to speak about the UAE, we had what we call the Pink Caravan. Again, a lot of doctors and influencers, were part of this Pink Caravan campaign in order to promote breast cancer awareness during Breast Cancer Awareness Month. Moreover, mental health, super important. And, people are getting affected by social media because you see all these influencers, they portray this rosy life. And you always feel that you're not having such a nice life as they are. And this contributes to a lot of, mental health problems, depression, anxiety, a competition between people on social media. So the hashtag You Are Not Alone campaign did a lot of, help for people, and similar campaigns reduced stigma and signposted crisis services in these instances. So professional development and networking, of course, that's very important, especially for us on LinkedIn. Uh, one of the forms of, promoting and letting people know about the RCP Updates in Medicine conference was through LinkedIn and social media. Because again, this is where we open. Met Twitter and X, there are a lot of journal clubs, case discussions, there's rapid dissemination of research. LinkedIn, again, for CPD, mentorship, professional identity building. YouTube, we have a lot of videos explaining to the patients how to use different medications. And of course, we have what we call the digital common room, where platforms have become the new conference hallway connecting clinicians across specialties, geographies, and career stages 24 hours a day. So social media compresses the gap between research publication and real-world clinical and public impact but speed demands accuracy. Accuracy, I would highlight and underline 10 times. Please make sure what you publish is accurate, so you're not part of the misinformation. Publish, amplify, and impact. So what are the risks? What can go wrong when you publish, and why does that matter? So the misinformation epidemic, the WHO declared what we call an infodemic alongside COVID-19. And this is probably the time where anyone started talking about health, let's say. False health claims spread 6 times faster than accurate information on social media platforms. And I was having a discussion with Dr. Adil, my colleague, about this. If you want to become famous on social media faster, unfortunately, when you speak against the tide, so when you speak about, the medication side effects, even if it's wrong, you will spread 6 times faster than speaking about a good effect of medication. So again, we need to be cautious. You do not have to follow the speed. You need to follow your conscience and make sure that you are spreading correct information for your patients so you're not part of the problem. What are high profile harms that happened? Of course, we had anti-vaccine content, which led to measles outbreaks in Europe and the US, linked directly to social media driven vaccine hesitancy that we still find a problem in now. Unproven treatments. Ivermectin was one of the big things during social media. Ivermectin was, publicized as a hidden cure for patients with COVID. Later on, with patients with cancer, again, it was Mel Gibson came out and talked about ivermectin being some cancer cure. Then we had, public figures talking about bleach ingestion, miracle cure posts that actually caused documented patient harm. Eating disorder triggers, we had algorithm-driven content that amplified harmful body image material to vulnerable young people. And then we had a mental health crisis where we had correlations between heavy social media use, depression, anxiety, and self-harm in adolescents. So again, this is why we need to be very, very cautious about this. Then what are your professional boundary violations? When do you cross the line? So if you talk about patient identification in case discussions, so be sure that you do not identify any of your patients. And I think we are well aware of this, but sometimes, we can forget, let's say. Accepting patients as social media connections. Again, this is where you might cross the line, so you need to take care of that. Posting clinical images without a robust consent from the patients. And we see this in surgical procedures, unfortunately, a lot. So again, we should be cautious about this. Venting frustrations, even indirectly identifiable content. So we need to be aware of this and expressing views incompatible with your professional registration. If we talk about the GMC guidance, online conduct is held to the same standard as face-to-face conduct. And actually, this is reflected in DHA and had my talk today. When in doubt, please do not post. The burden of proof for anonymization is very high. This is the algorithm amplification. The algorithm is not neutral. Platforms are optimized for high engagement and not accuracy. And that's why sensational health claims outperformed the nuisance clinical evidence by design. So clinicians who engage in good faith may, without, their inadvertently might amplify harmful content through interaction. So you need to take care when you interact with even harmful posts, because you might actually amplify these harmful posts. So take care of that. Finally, ethics and regulation. Do take care of your local guidelines. In the UK, the GMC guidelines. In Dubai, the DHA guidelines. And wherever you're at around the world, just take care of your local guidelines. Transparency and conflicts of interest. You always must disclose your pharmaceutical or industrial relationships, speaker fees, personal opinion versus institutional opinion. Super important, especially when you talk about medical things. It's either that you talk, when you are supported by evidence. But if you are not supported by evidence and this is your personal opinion, please state that this is my personal opinion. Second of all, do mention that you are not representing the institution you work at. Qualifications do not overstate your expertise. Very, very important. So this is what we call the newspaper test. I'll skip it for the sake of time, but engaging safely. So finally, what is the practical guidelines? Do build a professional online presence. You've done well. A social media presence enhances rather than undermines your professional credibility and patient trust. What are the principles for safe engagement? Identify yourself clearly. Never discuss individual patients. Do fact check anything before sharing it. Separate your personal from your professional platform. And this is advice I would give to everyone. When you respond to misinformation, when there's a patient in front of you, pause, assess before engaging to avoid escalation. Acknowledge, validate concern without endorsing the false claims, and then correct. These are very sensitive issues for the patient, so you need to take care of this. Offer clear, calm evidence and sources. Don't take it personally when a patient talks about this. I know it might anger us somehow, but you must not take it personally. And sometimes you have to signpost and direct the misinformation to your local authorities. Trusted sources to amplify: NHS UK, WHO, peer-reviewed journals, NICE guidelines. And then if you are a team lead or you're a head of department, do develop a clear social media policy before incidents occurs. Provide training, what is and what is not acceptable. Designate individuals for official institutional accounts, and have a crisis communications plan for viral misinformation. So the evolving landscape ahead, now maybe next year we'll start talking about AI-generated health content, deep fakes, synthetic misinformation at an unprecedented scale that we're already seeing. And emerging, there's platform regulation. We have the Online Safety Act of 2023. And next we'll have social prescribing meets social media, where you have curated digital health communities as part of care pathways. Again, I think we're already seeing this, but it is growing more and more. Our key takeaways for today: please engage. Your voice has credibility. Use it to counter the misinformation and educate your patients and public. Do maintain your professional standards without exception. And always keep in mind, please protect your patient first and always. Confidentiality, consent, and dignity are never negotiable in any medium. Thank you so much, and over to you, Dr. Bakhit.
Very much, Dr. Salam, for the interesting discussion and presentation, which sparks lots of questions in the Q&A. Hopefully we'll be able to address as many as we can during the panel discussion later on. I'll now move to our next speaker, Dr. Adhikary, who's a family medicine consultant and Deputy Medical Director at Mediclinic Parkview Hospital in Dubai. I would also like to thank Dr. Adhikary for his instrumental role in the organization and success of the conference. That's a personal thank you of me. Dr. Adhikary is going to talk to us about how to responsibly build a professional presence as a physician in social media platforms. The floor is yours. Thank you.
Thank you, Dr. Bakhit, and thanks to all RCP for this amazing 3 days conferences. Cannot be done without your kind collaboration and support. I would like to stress on the points that my dear friend and colleague, Dr. Yanal, mentioned in his talk. When we talk about a professional digital presence as a physician, it's a very key point when it comes to social media and medicine. I just remember I started my journey in social media 5 years ago. At that time, it was a stigma for any physician to be on social media. We as physicians, we are trained in medical school and residency programs, and we think that giving webinars, small talks at hospitals, sometime at government institutions as a general talks to audience, that's more than enough. These kind of talks delivered around 100 to maximum 1,000 audience. When it comes to social media, a very simple video can reach up to millions. Now we are seeing most of the physicians are encouraged to go into social media with the presence of private sectors here in UAE and especially in Dubai, where the competition is high between physicians to have patients. All physicians now have a social presence on social media, which is quite interesting, comparing that to 5 years ago. So the question is regarding the professional presence or physician presence on social media. If a patient searches for you tonight, what will they find? For example, if you are a urologist, will they find information about urology, or will they find you talking about politics or geography? These things are very important. Your digital footprint now proceed your handshakes. Patient used to Google your name on the hospital website. Nobody does that anymore. A recent article on New York Times showed that most of the new generation now Google their medical information through TikTok, through social media, not through Google anymore. So if those patients now they're growing up and they search for your name on X, on Twitter, on Instagram, on TikTok, what will they find? 83% of adult internet users search for health information online. And we used to call it Dr. Google. It's not Dr. Google anymore. It's Dr. Gemini, Dr. ChatGPT, Dr. Claude. So things has even changed. More than 1 billion of health related questions reach Google every single day. And 100% of internet users aged 18 to 49 search health topics online. And when they search for you, choosing a clinician has become a consumer decision. We can see that most hospitals here, especially in the Gulf countries, especially the private sector, they are now trying. Now, Dubai tried to make the hospitality, the aviation, the restaurants 7 stars. So now we are doing that for our patients in the hospitals. Part of that is choosing a clinician. With the health insurance now, patient has the right to choose any hospital to go. And there are plenty of physicians to choose. So choosing a clinician has become a consumer decision, where with the decision increasingly starts with the screen. Every patient who arrives by referral routinely verify the physician online before they trust them in person. So when a patient doesn't see anything about you online, usually he doesn't come for a visit. That's now happening, unfortunately. And what is that information? As my dear colleague Dr. Yanal was mentioning about the infodemic by WHO, these things are much more higher when it comes to patients. Up to 51% of vaccine-related social media posts contain misinformation. 20 to 30% of YouTube videos on emerging infection are misleading. Up to 60% of pandemic-related posts carried unreliable health information. Why is that? Because if a patient comes to me and people now are starting to have the conspiracy theory. So if I tell a patient you have hyperlipidemia, you need to start onto statins because that's will reduce your risk of MI, strokes, heart attacks. He will tell you no. I have seen a social media video with 30 million view that if you drink water with ginger, that's more than enough, and a statin is just a conspiracy. These things, misinformation, you are not doing any good because you are seeing maximum of 30 patients or 40 per day. But for some reason, still patients are trusting us, are trusting doctors, because we are trusted by default as being one of the highly valuable jobs in history. And they know that we have the good information, but we don't go and fight and counterattack those false information online. So what do? We should articulate what a professional digital presence is. We should be able to select which platform is the best platform to have our digital physician presence, apply the professionalism through that platform, and recognize and manage confidentiality and build a practical roadmap to professional presence. So what does that mean? So professional digital presence means the deliberate, identifiable, and accountable representation of yourself as a clinician across digital channels, governed by same professional standard that apply at your clinic or at the hospital. So it builds around a defined audience. It is accurate. It is evidence-based. It is goes with the professional you are in person. Unfortunately, these things is really important, but it doesn't deliver a high viewed videos on social media. That's why people goes with the wrong information. Many of the physicians, unfortunately, they go with reposting few things that just for the views, not just for the for not evidence based, but just to collect people and to have some fame. They think that it's a substitution for a clinical consultation, and they do diagnose and treat patients online that they don't even know, just to have some sort of fame and more followers. Most of the physicians, they are on LinkedIn. LinkedIn is a good platform, but it only attracts professional people seeking for jobs. And that's where if you start a LinkedIn account, you see most of the private messages are just CVs coming to you. Facebook is very famous, but between expats more here in the country. Twitter X is famous, but again, TikTok and Instagram is there. What is the evidence-based benefit? So for the physician, continuing professional development with the current evidence, peer networking, academic visibility. 70.6% of health professionals use social media for professional development. That's interesting. So we can see that some famous people, when COVID time was there, we used to see or read or follow, for example, Anthony Fauci, Eric Topol. We used to see them on Twitter X to just to get the updated information. So even physicians are using social media to get information. When it comes to patients, they use it to counterattack physician opinion. So that patient used it, also professionals like physicians are using that. Now, when it comes to e-professionalism framework, it's about integrity, confidentiality, accountability, and respect. So what do we do? Here in the country, we have a very regulated healthcare authorities. I remember I was having a discussion when one of the American healthcare leaders, he came here for a visit in the country, and talking to us, he said something very funny. He said, here in Dubai, your health is regulated a lot, which is quite good. So we have policies very clearly from Ministry of Health, Dubai Health Authority, Department of Health in Abu Dhabi, a very well organized policies when it comes to social media, advertising, health content control, even in hospitals. Like I work in Mediclinic Middle East, and even in our current hospitals in Mediclinic around the country, we have another internal policy for social media use for physicians. So we are really well regulated when it comes to that. But again, we have also the international bodies, and we need to declare our name, credentials, and every physician has a healthcare license that will be questioned when he provide a false information. Now, as I was mentioning, LinkedIn, when it comes to physician now, LinkedIn is very professional. You meet leadership. Many physicians, when they were active on LinkedIn, they got promoted or they got another job in a higher position in another hospital. So it's really good. YouTube, it's a for long videos. With the new generation now, most of them, unfortunately, they have short attention span. So they are not a fan of long videos on YouTube. Most of them are on TikTok and Instagram with younger population outreach. Twitter X usually goes to academic people, VIPs, and leaders among the world. Now, you should always, when you are in the social media as a physician, you should always lead with evidence. Don't try to make people happy. Try to provide what is really the right information, the correct, accurate information. And sometimes you need to make the information simple because people, they don't understand medical term, and that's the tricky part. But again, you should not dilute it a lot to make it very like COVID is fine, don't worry about that. No, you should provide, it's a very tricky skill to provide a correct information with a simple language and show that it's very important and you are honest, but also show part of our uncertainty. Why people prefer wrong videos? Because they provide them with certainty. Medicine is all about uncertainty. So show that, be very honest with people on the social media. Now, but there is a risk. 45% of healthcare staff admit they accidentally sharing patient data on social media. We find that really interesting, unfortunately, and we think we need people to know. But from our professional ego as physician. We want to become famous. So sometimes you see an interesting case of patient with, for example, with lupus, who developed a very interesting sign and symptom. You treated them. Suddenly it's on the social media. I found a patient. When it comes to small countries like UAE and especially like in Dubai, when you mention some sort of patient, even without his patient IDs or patient date of birth, people will still know because we are a very small country. So just be careful of that because this is exposing patient on social media and you will be questioned for that. 30% of patients have received friend requests from patients. So imagine a very professional relationship between you and the patient, and now he's a friend on social media, which is quite interesting. This carries a potential risk. 10% have experienced online harassment related to their work. So there are some red flags. So sometimes you provide an interesting case on the same day. Don't do that. Just wait for some times. Change the identifiers so people can know that this is an interesting case, but people shouldn't know who is that, especially in small countries like us. And replying and diagnosing and treating patient. You can only diagnose patient through proper consultation, either a physical consultation or teleconsultation, but not through social media. And sometimes you have a paid promotion. When you become famous, people and companies, they approach you for advertisement and ads. If you want to do that, make sure it's legal, it's ethical, and you should disclose that information. And don't engage in aggressive critiques in public. Like if you are not sure or you are debating a gray area in medicine, don't do that in public. You can always have that kind of session between your colleagues, but don't do that in the social media because people will not understand. This is a scientific talk. People will think physician, they know nothing. Just be careful of that. So protect your boundaries and yourself. Separate the streams. Keep a clearly professional account, hold the line kindly, and guard your well being as well. Because if you get addicted on social media yourself as a physician, then it's a sign of addiction. You are more prone to have depression and anxiety if you get addicted on social media. So, as a takeaway message, your patients are already online, so a professional presence now is part of practice, not optional. Silent is important sometimes for the misinformation. Physicians are uniquely trusted to fill in. Standard of professionalism do not change online, they simply become more visible. Choose few channels, anchor every claim in evidence, and protect confidentiality. Start small, don't buy followers, don't go to marketing agencies. Just be yourself and try to help people through providing a correct information. And thank you so much.
Thank you very much, Dr. Sejwani. A very interesting topic. A lot of complex issues need to be addressed. A lot of interest from the audience, many questions coming through. So I'm sure we'll have a very lively panel discussion later on. You did touch on the medical misinformation. And our next speaker, Dr. Ali Al-Dabbah, who is a consultant family physician in Sulaiman Habib Hospital, will hopefully talk to us a bit more about how to identify misinformation and how to address it professionally and responsibly. The floor is yours, Dr. Alia.
Thank you so much, Dr. Bayet, and thank you so much for Dr. Yanal and Dr. Adil for their informative presentation. I obviously going to be speaking within the same concepts as theirs. So basically, talking about the social media, as Dr. Adil said earlier, probably 5 years ago it wasn't that important, and we wouldn't be talking about it in our conferences. But now we have to because it became part of our job, part of our life, and people are scrolling all the time through the social media. They are coming to us with the questions that we have to answer. If we don't answer, we probably lose our credibility with our patients and we will be in a position where we can't help them. So I call it scrolling through danger because it can be really dangerous sometimes when it hits into people's lives and people's health. When exaggerated information or exaggerated risks are shared online and people don't find the real answers for them if they approach their doctors or if they search for their doctors online. So, and it's dangerous for us as well, as I said earlier, if we can't clarify the information properly to our patients. So I think these figures, Dr. Adel also talked about some of them. So basically, patients are getting medical advice through strangers online. So when they get a medical information, they don't look who's posting this information. 87% of posts on social media are inaccurate health information. So people do see this information, but they don't see who is posting them, but they actually believe most of them. There are 3.8 billion social media users exposed to incorrect health information, and usually for the incorrect information, it takes 70 hours for it to be corrected by the trusted authorities or by healthcare professionals. And this is a quite long time for this number of people to access those misinformation and not being able to know the real ones. Right. The algorithms on social media, they don't care whether the information is wrong or whether it's going to kill or going to cause health harm to people. So a wrong health information on TikTok can reach a number of people within 1 hour, more than a medical journal can reach in 1 year. And this is quite dangerous and quite scary. Same with other platforms such as YouTube, and even shared WhatsApp messages can reach much faster. So I will give later on some examples about some misinformation that were reached much faster than the correct information reached. And the main reason why is because as my colleagues, Dr. Yanal and Dr. Adil said, healthcare professionals are not present enough probably on the social media as much as others are present. And usually the easiest way of a post to be viral or a person to be viral on social media is talking about health information, or talking about, as Dr. Yanal said earlier, about the side effect of medicine, or start their video with a sentence that doctors lie to you, and then they say whatever they want to say and people will believe them. So why myths travel faster than facts? Scientifically, they do, because there is a confirmation of bias. People usually like to think about the negatives or like to think about the unconfirmed, and then once they hear this information, they will believe it more. The emotional resonance of fear and hope is higher than scientific or academic data. And the social proof, it's a post that millions of people are sharing, then it's true. And obviously, as we said earlier, the speed of asymmetry, the misinformation spread much faster. Statistics say 6 times faster, as Dr. Yanal said, more than the correction information. This what makes myths or misinformation spread more and believed more within people. So I'm just sharing some myths, very common myths that we've seen on social media over the last few years, and people did believe it, and give an example how the correction of this myth came very late. So, for example, a post talking about drinking lemon water every morning will detox the liver, and this post was shared 2.4 million times on Instagram. While the British Liver Trust in 2023 corrected this information and said liver detoxificates itself without any continuously, no food or a drink can help with that. Who knows about this? So this wrong information goes 40 times faster than the correction itself. And even if the correction reached so many people, probably they won't believe it. The other one is diabetes. Over the last few years, there are a lot of talks on the social media platforms about diabetes medication and weight loss medication. It's the trend. Whoever wants to go viral would talk about the weight loss medicines, and there are different aspects of how they talk about them. They either give the very reassuring information, encouraging everyone to go and get them, without acknowledging the risks and the side effects, or the other way around. They will exaggerate the side effects in a way that make people scared of them. And then when the correction information comes, it's too late, because some of people will even stop their treatment and cause harm to themselves. Again, the vaccine myth, my colleagues talked about it as well, because it's one of the very famous myths across the history. And so many people know about it, but very few people know that this, actually it was corrected, and the person who was behind it lost their medical license as well. But it's still affecting our practice till now. Still, we have a lot of resistance to vaccine because of it. Right, the natural cure of cancer is one of the biggest myths in medical history, because people are dying because of it. Some people are diagnosed with cancer, but they go behind the myth that I will just go with a natural kind of treatment. I will not undergo any surgery or chemotherapy. And the history tells us about the famous person is Steve Jobs, who lost his life because of pancreatic cancer, which was diagnosed 2003. It was operable, but unfortunately he decided to go to the natural way of treating himself. And when he found that this is not going to work, it was unfortunately too late. And his doctors have admitted that the delay in the treatment has been fatal. Right. So knowing that, we come to the fact that as doctors, we need to show up online. It's not easy. It's very challenging. Because, as we said, there are a lot of ethical issues behind it, a lot of legalities behind it. The time, usually we don't have the time for this. Most of us probably, we haven't been educated to be online when we were in medical schools. Probably some people don't have the confidence or don't have the willing to do that. But the presence doesn't have to be in one shape. It can be in different shapes, as long as we can do something. Because if we are not at the table, we are not on the menu. If we are not present, patients will not come and ask us. They want us to be present. So, and Dr. Adil said it earlier, people search for us online, and if they don't find us, they will not book an appointment with us. So sitting in our clinics waiting for them to come and ask us about the correcting the information, usually, unfortunately, doesn't happen all the time. However, just trying to be positive, we are still trusted voices. So some statistics said that patients still consider or rank the doctors as number one most trusted source of health information, but actually they want to hear those information. This is why we need to be accessible, of course, without forgetting our ethical duty and all the regulations behind it. Right, so what do we need to do? I think Dr. Yanal has already talked about this before. So we need to first know the information that the patient is struggling with. We need to acknowledge it. So don't be dismissive. Listen to the patient, understand their concerns behind it, try to acknowledge, and then correct it in the way that they want to hear it, or in the way that they understand it, and then build our own digital presence so they can refer back to it. Or probably when someone comes to the clinic, I experienced it myself. When someone comes to the clinic with a misinformation, they usually have discussed it with a lot of their friends or family members. They have shared it on WhatsApp, on social media platform, and I find that if I correct this information to them, they actually share my opinion with those people. So if I guide them or refer them to my social media platform, for example, or share a video with them, they will probably share this video also with the other people. So this is why we need to be present online, not just to help the patient who is in our clinic, because we might see like how many 20, 30 patients a day, but there are thousands or even millions of people who can find this online. So this is very, very, very important in sharing the correct information. Yeah, so again, the most powerful health information comes from the doctors, and people are not looking at the knowledge now because the medical information can be found anywhere. Anyone can access the most recent articles, most recent journals, and can find the diagnosis, can find the treatments. But what matters for a good doctor, in my opinion at least, is how to communicate and how to reach to their patients and how to convince them or reach a conclusion with them that they do the best for their health and themselves. Yeah, so this is what I said earlier. So we didn't learn how to be on social media in schools. It's the other way around. We probably, in some very difficult medical schools, probably my age, it was I lived a very antisocial life to be able to pass my exams and get a degree. But now we need to be present socially. If we don't find ourselves able to do, for example, videos, there are lots of other ways. We can write posts, we can do an infographics, we can just involve in a conversation, for example, on a specific post, but obviously keeping with the professionalism. And we can use the AI nowadays to be present also and assist patients to reach the information. The goal is one, is to reach to our patients as fast as we can in the most appropriate way possible. Right, so I just wanting to share personal experience with you. We have talked about regulation. I was medically educated and practiced in the UK, and I moved to Dubai in 2022. So the time when COVID pandemic happened, I was still in the UK, and I really struggled myself with this dilemma, with the misinformation dilemma, because the misinformation were going very fast. Obviously, people were locked down in their houses and they did nothing apart from scrolling through the social media. And the misinformation are billions. And as healthcare providers, by the GMC, we were not allowed to go on platforms and talk or give information. Even the responsible bodies at that time took really long time to appear on the TV and give information. And people were massively misled through this pandemic about the spread, about the lockdown, about the symptoms, about the risk of it. And later, even with the vaccine, we had a big dilemma about convincing the patient to take the vaccine, because they were most of them were very resistant to it. So I thought it's as a healthcare provider, the 10 minutes consultation that I had with my patients in the clinic was never enough to fight those billions of information coming from all over the world. And at that time, I wasn't present on social media as a physician, but at that time I thought, well, I have to. And this is where the idea of wanting to give the health information, helping people to learn about their health and learn the real information was came to me. Right, that's it really. So just to take home message, staying connected with your colleague is really important. Having the discussions about what's going on, attacking the myth at the time when it's there. Don't wait too long because it travels really fast. And obviously, as my colleague said earlier, stay professional. Don't go into useless conflicts, let's say, and guide your patients to the best, or to where they can get the right information from. Thank you so much.
So thank you very much. Really fantastic, 3 fantastic talks, and we've got some lovely time now for the panel discussion. So we'll start to work through the questions online. I think what I've been hearing is that we all have some form of digital presence, which we may or may not like, but we need to be deliberate about it. We need to be thoughtful about what we can control, and that might include the platforms we use, what we post, or what or whom we engage with. And then we need to present ourselves as an accessible, trusted voice and the steps that we can take for that. So joined by our three speakers, and perhaps if I could start with Dr. Salam, please, in terms of one of the questions, do you think social media is changing the doctor-patient relationship? And is that a good thing?
Absolutely, absolutely. Especially in our practice here, in private practice. First of all, patients are actively looking for physicians who have social media presence. So the first meeting between you and your patient might be on social media through the videos you have posted. And then that brings him into your clinic. And is that good or bad? It really depends on what you're posting. So if you are posting things that are medically relevant, you know, backed by strong studies, then yes, of course, that is something positive. But if you are posting all sorts of nonsense, which we do see, unfortunately, then yeah, it might be something negative. And nowadays, the trend in Dubai now is to listen to ChatGPT. Only last week, I had maybe suddenly I started appearing on ChatGPT as a recommended internist, and I had people coming from all over the country based on ChatGPT's recommendation, even though this is just by an algorithm. So it doesn't mean I am better than anyone else, but you just pop up due to an algorithm that you don't even know what happens, but you pop up and patients will follow ChatGPT. And this is actually amazing because it doesn't mean you're a better physician than your colleagues. You might, for example, be the worst physician on earth, but ChatGPT is recommending you, and hence patients are following. And I, this is a two-edged sword, to be honest.
Okay, thank you. So, Dr. Sajwani, what is your take on doctors who have huge followings? Are they influencers first, or are they doctors first? Is Dr. Sajwani still with us? Oh, okay. Well, we'll park that just for the moment. Perhaps, Dr. Adhikary, in terms of, do you think medical content on TikTok can ever genuinely be educational?
Yeah, I think it can. I mean, it depends on who is the video for. So it can be educational to people. It can even be educational to colleagues or to healthcare providers as well. So yeah, I have some like junior doctors, interns, or medical school students, and they tell me that they do follow a lot of educational accounts, and sometimes they share the information with me. Some of them are correct, some of them are wrong. So yeah, I mean, anything can go on TikTok, and we can expect anything.
Okay, so back to Dr. Salam then. Has a post or video on social media ever changed your clinical practice or thinking?
Oh, not really. I mean, I came across just today. I came across a very nice video by one of our colleagues. He was explaining about a new study about vitamin K2 and how they were comparing artery calcification with people using K2 over the long term. And it was very interesting, and I actually benefited from it a lot. And it made me look into the study. I didn't get a chance to look into it now, but I plan on doing so. And this started from social media. But changing the total practice, no, but it makes you look into data that you think might be interesting.
Okay, thank you. I don't know if we've lost Dr. Sajwani, but so I'll come back to you if that's all right, Dr. Adhikary, in terms of what's the one thing you wish patients understood before Googling their symptoms?
I wish they understand that. I mean, I'm sure they do, but I don't know what's the problem here. I wish they know that those information on Google or even on social media are not written by healthcare providers and not based on real evidences. So not everything there is correct. And I'm happy for them to search and then come to me to ask me what is correct and what is not, rather than coming to me challenging me with the information they read online.
Okay, thank you.
Dr. Emma, if you allow me, I just have a question actually for the both of you, just for discussion. How much would you think is a fun? How much fun should you put in a post? So we see nowadays doctors dancing, going around doing all sorts of things on TikTok and social media. So where would you say too much fun is just too much? You shouldn't go. You know, where are the borders for that, do you think? Or are there no borders? Can you just do whatever in order to give a nice piece of information?
So from my perspective, we heard about the red flags, and one of my questions that was going to be to Adil was about where's the red line? Absolutely. Where is it? About photographs. There's some young surgeons in the UK got almost obliterated on social media for having posted on holiday in a bikini or and this is the challenge about if you present yourself on social media and you state that you are a doctor foremost and then part of your profile is other things. I think it's around, and I think one of your slides was going to allude to it, you know, in terms of what would you be happy to see on the front page of a newspaper? What would you be happy for your parents to see? What would you be happy that if you were sitting in the clinic and you had your patients in front of you, would you have a photograph of you in a bikini behind you? Not necessarily you, but you know what I mean. So yeah. In terms of, I think it is that this is about, and I think you described very beautifully about the deliberate use, you know, your deliberate digital presence. And I think some people, there's a catch up of what they may have loosely put on social media in the past, but I think now it's such a thing that it is about, you need to curate your digital presence. What is it you want to be? Is it professional or personal? And there are some platforms that, you know, LinkedIn, for an example, you would want to present that professional look. It may be on Facebook. Facebook, if it's closed to your friends and family, the people you want to share those with, then you should close it to that. So if it is tricky. I think as a profession, we are slightly different because we are such a trusted source of both opinion, evidence, and how we manage our patients that we do need to protect our professional identity. I don't know if you wanted to add anything.
Yeah, I think, I totally agree with you, Dr. Emma. I think, Dr. Yanal, the boundaries, you asked about the boundaries, and the boundaries is our profession. As physicians, whether on social media, in the clinic, or in social life, there are some boundaries that we can't share with everyone because we are professionals, especially when patients are there. If it's only our friends or our families, then we live ourselves and our personality. But when our patients are watching us, we have to keep that professional boundary, of course, with them. So yeah, I don't find myself talking about a medical topic and while dancing or while being so funny. I mean, being funny, if you are a funny personality, that's fine. But being so funny while talking about a medical subject, I don't think. I mean, some people like it, but I don't think it's what's the purpose behind it.
So, Dr. Sajrani, thank you. You're back with us, so that's good. Can I come back to the question? What's your take on doctors who have huge followings? Are they influencers first, or are they doctors first? Okay, maybe I'm not sure, we're obviously having problems there. So maybe, you know, would you mind having a go at that one?
Yeah, so I think once you put your name on social media as Dr. So and so, then you are a doctor first, and you have your obligation to your patients. So I know some colleagues, for example, who are interested in fashion or whatever, but they do it as, you know, someone who is a professional in fashion design, but she does not put her name or his name as Dr. So and so. But once you post as you are a physician and you are a doctor, then I think that is the priority for you. Uh, and then you can become what we call a medical influencer instead of just a usual influencer. I think we're blessed with Dr. Alia. She has a huge following. I think she posts great videos. Dr. Adil, again, great videos. Everyone has his own style. I follow them both personally, and I would advise everyone to follow them because I
Okay.
think they fit in with whatever with everything we're saying.
So, Dr. Ali, how do you react if suddenly there's a pile-on, that there's real negativity about what you've posted? How would you respond and react to that?
Yeah, trying to be professional. I mean, the negative response is usually the disagreement with what I say, and I do respect that. I try not to react, and I try not to answer back and forth, because what I need to say about this specific topic, I already said it in the video or in the post, so people can either take it or can attack it. But we do expect that because obviously we are going public, so people can react the way they want. So usually, if there is a negative feedback, I try not to really react immediately with it. I probably after some time answer it in a video concept, probably to answer the questions or to conflict the ideas that they were there. But I don't react back and forth.
And what about if you post something that you then regret? How do you respond to that?
I hope that doesn't happen. But I mean, it didn't happen so far, but if it happens, I would probably correct, I wouldn't delete it. I will keep it, but then I would, obviously, if it's massively harmful or wrong, I would delete it. But if it's something that changed, because, you know, like even medical practice changes. So if something changed, I can post like another post linked it to it and say, well, I want to correct the information I said before, or I want to change the idea that I had before, which is fine.
It's a bit like don't post anything if you're drunk, tired, or
Yes.
angry.
Yeah. Yeah.
Okay, so Dr. Yana, in terms of if you're setting off as an individual, trying to create your digital presence, how much should your organization support you or be responsible, or how do you come alongside with your organization, or should it be a completely separate thing?
Uh, so actually, this really depends. I've worked in public and I've worked in private. Uh, the legalizations and legislations when you work in a public hospital are much tighter. So you would have to declare everything to your hospital, and especially if you're in a government public hospital, you would have to declare everything. And sometimes they don't approve. They don't like their doctors being on social media because this can bring a headache, and they consider you as part of your contract that you are representing the organization, whatever you are saying. In private hospitals, they actually encourage you to go on social media because they believe that this is a way to attract more patients to your practice. So it really depends on where you are practicing and is it the public or the private scene. But in either case, I would obviously recommend that you declare it to your organization and your administration uh, if you are doing anything on social media, so you are within the boundaries of your contract.
Okay, thank you. And Dr. Alia, in terms of how do you react when someone comes in, they've read something on social media, they're completely convinced by it, but it is wrong? How do you respond to that?
Yeah, so the first, when you say someone, you mean a patient, right?
Yes, a
Yeah.
patient comes to
So
see
the
you
first,
in clinic.
yes. So the first thing I would say, can you show me this post? Because before I give a reaction, I want to see who is who's talking and in which way they are talking. And while I'm watching the post or the video, I put my ideas together as well. So I give myself time to brainstorm as well. So this is usually the first thing that I do when they tell me I saw something online. I tell them, show me. And then I see it with them and start, obviously, as we said in the presentation, acknowledge what the patient concern. Like, for example, if someone talking about statins, but the patient doesn't take statins, then what's your concern? So just knowing what's the patient concern, because some patients, talking about the statin topic, some patients don't take it, but they just tell me, but doctors have been giving it to people for a long time, then doctors are lying to us. So that's the concern. Should I believe my doctor? So usually just knowing the concern, address it, acknowledge it, and then try to reassure the patient as much as I can. Sometimes it works, sometimes doesn't, but we just keep trying.
Sometimes we
Okay.
have to be very personal with our patients. I mean, all my patients know I am on a statin, for example,
Yes,
because that
yes,
convinces them to take a statin. In terms of vaccination,
yes.
I always tell them if I didn't take it myself, but because I'm not in the age group, but I tell them I gave it to my father, my grandmother, whatever. So you have to be very personal because uh, this is the way. If they feel that you feel it's safe for you and your family, and you are treating them like your family, then probably this is the best way of convincing the patient that you actually believe in what you are giving.
Okay, so perhaps just come to the last question about do you think medical schools should teach doctors about how to communicate, what to communicate on social media as part of the curriculum? And if so, how should that happen? So perhaps to you first, Dr. Alia?
Yeah, I mean, considering the time that we are in and what's happening, yes, they should do. I mean, they shouldn't make it part of the curriculum, but they have to make sure that people who are becoming doctors are able to present and able to conflict the misinformation. I mean, when I think about it myself, I think the solution is one of two: either banning people from posting any health information on social media in all the countries around the world, or you have to educate doctors on how to be present on social media and how to correct that misinformation. Otherwise, things will go out of control.
Thank you. And Dr. Yunus, anything you'd like to add?
No, I absolutely agree with Dr. Alia. And I think by the time students at the moment graduate, they should have an idea about the ethics and the boundaries. Because we see a lot of doctors getting into trouble because of what might seem to be an innocent social media post. And we do see around the world revoked licenses, which is, the biggest fear of any physician. So, and it's most of the time it's because they're unaware of the consequences of whatever they're doing. So this should be, focused on, I think, in school curriculums, in order for, students and medical doctors to become more and more aware of this.
So thank you. Thank you very much. Three extraordinary speakers. I think it's such an important area and it was really good to explore it with you. So a big thank you. A thank you to my co-chair, Mohammed. And this is really now a nudge to go on to the next session, which starts in 1 minute. And then please join us for closing remarks then in half an hour. Thank you very much, everybody.
Thank you.
this exciting event where you will learn a ton. Before you go, be sure to register so that way you can get it on your calendar and you won't miss a thing. In addition, we will send you a confirmation email with the link to the live event or the on-demand version. Be sure to stick around, peruse our page, learn more about the event, and don't forget to register. We'll see you there.
Hello, everyone. My name is Wasim. I'm from Havas. We're here today for a session with Novo Nordisk and Dr. Alia, who's a consultant family physician at Dr. Sulaiman Al Habib Hospital in Dubai. For those of you who don't know Havas, we're the biggest healthcare company in the world with 72 countries and offices. Today, for my first part of the session, I'll be tackling why social media is important for HCPs and what's the important role that we could all play to actually shape credible health conversations online. As we all know, with the digitization and the moving forward and how digital our life becomes, healthcare is also going through that transformation where we have seen audiences move from search engines, which were traditional ways to look for information, more to social media and to actual AI now. And if we are not present and if HCPs are absent, then misinformation has a lot of room to fill the space. And this is not a trend. In fact, 77% of people who searched online for health information said that it influenced their health decisions. But as we all know, this content can be accurate or misleading or completely wrong. So why does this matter to you? Because if patients are already looking online, your content can help them find clarity before confusion. And by showing up online, you build stronger trust with patients, you position yourself as a credible voice in your field, and you help combat misinformation and empower healthier decisions. So where can we actually show up online? And we know that there's a lot of platforms with different functionalities, different opportunities for us to also connect with our audiences. And in today's session, we will focus on the two platforms that matter the most today. They're Instagram and TikTok. They're visual, short term platforms that help you make health information more accessible, human, and easy to engage with. And the most important part of setting up a credible presence online is to set up your profile and optimize it in a way that would help your audience or patients also connect with you. So, by clearly stating your role, by clearly explaining to your audiences what they will learn or gain from following you, make sure to include keywords that are relevant to your practice. Using a professional image also builds more credibility, and adding a call to action, so making sure your audience can connect with you or be redirected to your institution or your practice. In terms of looking at both these platforms as an opportunity to actually create this presence, there's a lot of formats, and we will touch on a few here that are shared between both platforms. We have the Reels or the short videos on TikTok, and they're generally best for discoverability, short explanations, and human led education. I'm going to play a short video that shows you the usual best practice on these formats.
We have a really important update for the treatment of obesity and for the evolution of GLP-1 medications.
So if we can see here on this example, there's a headline. It already tells me what this video is about. And there are also captions, so I can follow through this video without having my audio on. And that's really the best practice here, making sure your patients online can see what this video about in the first few seconds. Another format that is really popular for education or even for explaining complex situations or terms is the carousels or the photo posts. And as we can see from this example, generally it allows you to distribute the information as short snippets on multiple carousels, which will help you actually deliver that message to your audience. So the trick here is to keep it simple and keep the language as well simple. The third best practice in terms of format is you shouldn't care so much about design and branding as practitioners, but rather making sure your visual feed is clear, it has headlines, and your patients can know as well what they're going to interact with or watch. So as long as the visual is easy to understand, that is always a great sign. And then we have stories and highlights. Those really help you add or reshare specific messages that can also build connection and engagement. And later on, you can add them into highlights. So that is something that you can save so that other patients can also go through this information. And lastly, there's two formats. There's live. So if you have an audience, you could always go live for Q&A sessions. You can maybe do interviews with other health professionals. And lastly, we have the broadcast channel, which is essentially a way for you to build a community online. You can ask polls on it, you can share new updates, or you can understand what your community wants to know about, which will help you create better content. And just quickly, in terms of content strategy in which you can create content around to build your presence online, we have first educational authority. We have second myth busting and misinformation, which will help you correct that to your patients. We have patient guidance. You could also cover wellness and prevention. It's important as well to have the professional credibility content that shares more your expertise, and in today's world, showing your human side and making things really simple and straightforward will also help you build this presence. This was from my side, the social media part, and I'm going to hand over to Dr. Alia, who is going to take us through the second part of the session. Dr. Alia, all yours.
Dr. Alia, could you hear us? She can't hear us, right?
Apologies for the delay. We are having a small technical difficulty. Thank you for your patience.
Hello.
Hi, Dr. Alia, can you hear me?
I'm so sorry. I don't know. Something is wrong with the connection.
No worries.
Yeah.
We are live. I have finished my part, so if you want, I can start with your slides.
Yes, thank you so much, and sorry again about the technical issue with my connection. Right, so I'm Dr. Ali Aldaba. I'm a consultant family physician working in Sulaiman Habib Hospital, and I'm very interested in attacking myths about health, misinformation, correcting it, and delivering the correct information for patients as well as healthcare providers. So this is why it was my pleasure to be involved in this symposium today. Right, I just can't move the slides.
So if you want, can you see it?
Yeah. No, it's just frozen at the first slide. It's not moving. Even when you move it, it doesn't change to me for some reason.
All right. It seems a connection issue. We can suggest if you want to open the slides on your desktop, and I can match the number you're on.
Yes, sure. Right, so just starting with disclosure, the information, it's my personal views. It doesn't reflect my institute or the organization I work in. It's only for educational purposes, and it shouldn't change clinical judgment and individual patient care. So basically, we want to talk about how we're going to combat the misinformation. There are several ways. It depends on the misinformation themselves. Where do we see them and what are they about? So we're going to talk about how we can do that, and we will give some real life examples and share some ideas of how we as healthcare providers can we do that. So basically, misinformation are not always a complete lie. They can have a part of reality, but they can be delivered with exaggeration, without context, or can give a misleading conclusion. And that's the problem. Sometimes they have some truth, but the way how they are delivered is not the right way. That's why they can cause misleading conclusions or information. So the claim can be totally incorrect sometimes, or some benefits of certain medication or certain clinical practice can be exaggerated or given unreal guarantee, for example, to people. The real risk of side effect can be presented but without a context, and some people can share personal experience without real medical evidence, or some comparisons between different medications or different way of treatment, and the hack itself can encourage inappropriate or unsafe use. So the misinformation can be presented in different ways, but the problem is one. The problem is patient risk. So I'm going to present some myths that we are seeing nowadays, since talking about Wegovy pill is now available, and we are seeing myths already coming up between people. So we try to attack that in a way that we can deliver the correct information to our patients based on clinical evidence, so we can help them to make the right decision. So basically the first example on online myths going on. So as the Wegovy oral pill is now available, clinical studies show that it helped to reduce weight by 12%. The average weight loss is 12%. I mean, this sounds good because it gives information, but it's not a fully realistic information. So what's the real information? We're gonna give some data regarding the average weight loss with it. So just to give an idea that there is no head-to-head comparison with other oral medication. However, there is a comparable study. So the Oasis 4 study is relevant to Wegovy pill, semaglutide 25 milligram, and here we compare to other study, which is Attain 1 related to orforglipron 36 milligram. The criteria of the two studies are very, very similar, which means that the comparison is credible. So let's look at the comparison here. So with the oral semaglutide 25, the weight reduction is actually reached to 16.6% by 64 weeks time or period of the study. The average mean weight loss was 17%. So the myth here says that it's like the other oral medication reduces the weight by 12%, but the fact is not. Actually can reduce the weight by up to 17% or even more, as we will see in the next slides. So more information from the Oasis study. So it shows that, I mean, around 71% reached up to 10% body weight loss, while 56% reached more than 15% of their body weight loss, and 34% reached more than 20%, which means 1 of 3 patients can achieve more than 20% body weight loss. And early responders have actually achieved more weight loss. So those who responded early and lost around 10% or more than 10% of their body weight in the first 16 weeks have achieved more and more weight loss by the end of the trial, and the mean weight loss was up to 22%. So knowing that, we know that sharing information of 12% weight reduction is misleading, because it's the weight loss achievement could be way more. And then again, if we compare with other oral weight reduction medication, orforglipron 36 milligrams, so different doses, but talking about 36 milligrams, the highest weight reduction achievement was by 12.4%, which is applicable to the information online, but not applicable to the Wegovy pill. And here, just to show the comparison between the two studies, shows that there is average of 3.2% more weight reduction when it comes to Wegovy pill in comparison to orforglipron 36 milligrams. Right, another example, another myth coming up nowadays with the availability of Wegovy pill, that it says oral GLP-1s is available now, but it causes more GI side effects and is intolerable to patients. So yes, side effects are there with every medication, but how common are those side effects? We need to make it more clear, and how people can tolerate it, we need to make it more clear. So basically, the fact says, according to the OASIS 4 study, only 3.4% of the participants in the study discontinued the oral semaglutide due to the GI side effects, and that's versus 2% with those who took the placebo medication. So this is a small percentage compared to the total population was involved in the study. The fact that the treatment discontinued due to GI side effects with other oral medications such as orforglipron was much higher. So it was 14 times more compared to the oral semaglutide or Wegovy pill. So this is to refer that some myths can have some reality, but it doesn't refer to the total reality. A third example here, that again about Wegovy pill, that it can cause drug interaction, and there are specific or complex dosing requirements, and it should be taken under specific conditions. So let's see what's the reality of that. So basically, the medication is fairly easy to take, sip and go. People can take it fasting, so they wake up, they take it, wait for half an hour, and then eat a drink as they wish. It doesn't need any specific requirement apart from that, and they can only wait 30 minutes, as we said, to take to proceed with their normal life. So it's improving willingness, while the benefits of it compared to that is improved willingness, because it's an obesity medication. There are real world evidence demonstrates that the medication is convenient to those who took it, and there is no clinically significant interaction with life-saving medications such as statins. It can be taken with women who are taking contraceptions, and there is no drug-to-drug interaction. So here, if we look at the table, again, this is a comparison. If we look at the oral semaglutide, it has no interaction with medications like CYP3A4 inhibitors, reducers, whether in strong or moderate strengths. It has no drug interaction with simvastatin, which is very important. It has no interaction with oral contraceptive pills, again, which is very important, and there are no significant differences in dosing with those who have severe hepatic impairment. And if we compare it to other oral obesity medications, obviously there are instructions in avoidance and not recommended with a similar medication, and there are a lot of dosing restrictions. So as we showed some myths and some all the myths we saw, they have some reality behind them. So how we can respond to that, how we can give the right response and the right information, it obviously depends on the claim. What's claimed in the misinformation, in the online misinformation, how it reaches to people, and what's the potential harm behind it, who are those who are directly engaging with it, and how we can engage with it and give the correct information without amplifying the wrong information, because this is very important. Sometimes we share posts because we don't agree with them, but we are actually contributing to the spread of this post. So how we can respond as healthcare providers? Obviously, we want to, there are several ways of how we can respond. We can either respond directly by showing part of the original claim and then react to it with the correct information. We can stand alone with just to create a reel or a post or a carousel and just say the correct information, or we can engage in a conversation or live to correct the information. So we're gonna just go into a little bit of details of those three different ways of reaction. So first one, as we said, respond directly. So you can create a clip, use the first 3 to 5 seconds to show the claim, the wrong claim in your video. Pause without repeating, because that will amplify it, and then state what's misleading in this post, and then correct this misleading information. I personally find that this is the best type of reaching, especially when we try to correct a misinformation while it's going viral or during the peak of it, let's say. I'll just play the video or part of it just to probably demonstrate what I mean.
Dr. Alia, I am not sure the video will play. So we have the screenshot that shows the article on top as an image.
Okay, that's fine. So basically in the video, he presents the misinformation and then he gives what's wrong in it, and then he gives the correct information, as we said earlier. The second way is the standalone correction. So basically, it's when the claim can be corrected without showing or directing the audience to the misleading content. Because as we said earlier, we don't want them to keep watching or keep hearing the misinformation. I did talk about this in my first presentation. Usually the brain click more with the misinformation because there is fear or hope in them. So we don't want to keep repeating it, but we want to just make a standalone video to talk about the correct information in order to deliver it to the without any exaggeration to the previous one. So we can explain what's false, what's exaggerated, what's missing. We can add the necessary facts and the context, and give the audience a clear and safe takeaway, or refer them where to go back to the correct information, or where they can find the correct information, and we can close with action or safety reminder. Third way is to engage within a conversation. It is best when the claim appears in comments or questions or active discussion with the audience. So it will be good to get engaged and answer their questions with keeping professionalism and without going aggressive, obviously, even when the information makes you angry, basically. So response when the confusion happens, acknowledge the question without validating the claim in the question or without validating the wrong information, correct the misunderstanding clearly, keep the response concise, easy to understand, friendly, as we said, professionally, and later you can give more information in a video or a post to keep it on your platform so people can refer it or share it with their friends or family members. And always close with action and safety reminder. So to recap everything that we said, so first we need to show up with a purpose. So as healthcare providers, we have a role to help our patients to know what's right and what's wrong. They need to find a credible person to refer to, and studies showing that surveys are showing that people still find healthcare providers are the most trusted source of information on online and social media media platforms. So, but if we are not there, they won't find us. So we need to show up first. We need to use the platforms intentionally according to that specific platform. And I'm sure this has been explained before my talk. So each platform has its own format, its own hooks, captions, and the frequency, and even based on the people, the population base. We need, this is a very important message that I find myself very frequent. I see it frequently on online platform, that people use very scientific wording or very medical wording. We need to simplify it. We need to make it friendly to the people who hear it. Friendly language without oversimplifying and without exaggerating, without using medical terms, because people will leave the video in the middle and will go to find what does this medical term mean, basically. Correct the misinformation safely. So we, as we said earlier, and I want to stress on this, avoid amplifying the false information, avoid to talk about it too much, address the misunderstanding clearly. What is wrong in this one? Because if you don't address the misunderstanding, people will pick something very correct in that misinformation and will tell you, well, this is correct. So you want to address what is actually wrong, and we want to explain the misleading and give the audience a safer takeaway message, and apply it to a real conversation when discussing topics such as Wegovy pill. Focus on the clarity, on the context, the eligibility, the safety, and the importance of professional medical guidance, of course. So the content we create as healthcare providers should reflect us as professionals, as expertise, and also the human side of us. We need to probably empathize with those people who are lost with all those misinformation. So showing empathy will actually reduce the gap between ourselves and them, and will help them to find more credibility in our information. So it should make health information easier to understand to people, easier to trust, and easier to act on safely. And most importantly, it should make health information easier to people to access. If we are not there, they won't be able to access us. Thank you so much.
Well, thank you so much, Dr. Alia, and thank you so much, Havas team. We really appreciate it. And it was very unfortunate that we ran into some technical issues. We really wanted to address your questions, our dear audience. I would like to ask kindly for you to please go to the take-home message and closing remarks session. I would like you to go all for it now, because we will about to start there. Thank you, everybody. Thank you, doctors, and see you there. Thank you, everybody.
big thank you to the extraordinary organising committee and to our wonderful iConference team. So much goes on for weeks, months before, not least changing from a face-to-face to an online conference. And then during the conference, there's so much going on behind the scenes, and it has been such a pleasure to work with everyone. And also a big thank you to our fabulous speakers, to our generous sponsors, and then not least all of you for attending. I think face-to-face is always lovely, but by being online, this has given us such an opportunity for so many of us to be able to learn together. In these times of uncertainty, professional connections have never been more important. And in times of accelerated change and artificial intelligence, having a trusted source of knowledge is critical. And then in times of our busyness, being able to revisit the content of the conference on demand will be so useful. We really look forward to meeting with you next year, or even sooner as a member or fellow of the Royal College of Physicians. A big thank you, and over to Dr. Yanal.
Thank you so much, Dr. Emma. I think 3 days went past in a flash. We do prepare for this a year in advance. I think the third conference we'll start preparing for maybe next week. So I'd like to really, really thank my co-chairs, Dr. Adil, Dr. Laith, the RCP chairs, Dr. Emma, Dr. Mohammed Bakhit, Dr. Omar, Amy. I think they have all done a big, big, big effort in getting this through. So thank you so much. I would also like to extend my heartfelt thanks to all our speakers, chairs, moderators, partners, and delegates. Thank you for being with us virtually from all over the world. Over the past few days, we had the opportunity to learn from leading experts, discuss advances in clinical practice, and engage in meaningful scientific exchange. Your active participation and enthusiasm have really made this conference a tremendous success, so thank you. On behalf of the organizing committee, thank you for being part of this journey. We hope the knowledge and insights shared throughout the conference will continue to support and inspire your daily practice. It truly impacted me personally. I learned a lot from my colleagues, so thank you so much for all of them. We are grateful for your support, and we look forward to welcoming you again in future events. Thank you, stay safe, and we wish you continued success in your careers and in the care of your patients. Thank you.
We're done.